Cases are going up, and they're going up rapidly.
COVID in focus.
Over time, that antibody response wanes.
The White House set to reveal plans for booster shots for everyone. And tonight we have in-depth coverage. Which shot do you need? When can you get it? We're clearing up any confusion.
If we have COVID transmission, they're going to be back in quarantine.
Plus, a school district abruptly changes course on masks.
So unfortunately, the Delta variant has changed the equation.
Douglas County schools fall in line and will mandate masks after all.
Lemonade!
And Colorado kids ready to help those trying to escape Afghanistan.
We're giving the money to the refugees.
First tonight, COVID-19 retaking center stage in the U.S. as the highly contagious Delta variant spreads. Data used by the CDC forecasts nearly 33,000 daily hospitalizations by mid-September. That is almost 3 times higher than the current rate.
And the virus's resurgence has school and health leaders grappling over masking students. The TSA now extending its own mask requirements for travelers, and the White House is preparing to lay out a plan for booster shots for all Americans.
Tonight, our Denver7 team of reporters will give you an in-depth look at the COVID-19 situation, what this all means, who it affects, and we sit down with health leaders to get your questions answered.
And we're going to start tonight with Denver7 Sloan Dickey, digging deeper into what we can expect to hear tomorrow about those booster shots.
Yeah, the Biden administration is set to announce a recommendation for anyone who received a Pfizer or Moderna vaccine that they get a booster 8 months after they received their second dose. This recommendation is based off of studies in Israel and from the Mayo Clinic that show the vaccine is less effective against severe disease after 8 months. These boosters will apply to all Americans regardless of age. This recommendation comes as the Delta variant is taking control of this pandemic. Right now, it accounts for 100% of new COVID-19 cases in our country. And here in Colorado, breakthrough cases account for 18 to 28% of new infections. Booster doses will start to be widely administered for all Americans once it becomes fully FDA approved, which is expected in mid-September. The White House says the U.S. has enough vaccine supply to deliver these booster shots to all Americans this fall.
It's essentially another dose of the vaccine. So it's the same thing that you got before. So if you took the mRNA, one of the mRNA vaccines that was 2 shots, those 2 shots were the same thing. It was just that you got it twice. Again, it's just another exposure. So it's the same shot.
Last week, the FDA authorized 3rd doses for immunocompromised Americans, and the state health department has asked providers to immediately start handing those out. Reporting in downtown Denver, Sloan Dickey, Denver7.
And tonight we are taking a closer look at some of your questions about these booster shots. Now, can your 3rd shot be a different vaccine than your first 2? Well, under its amended emergency use authorization, the FDA says the 3rd shot should be the same as your first 2. So if you got Pfizer initially, get a Pfizer booster. Moderna the first time, then a Moderna booster. And here's another question you might have. Do I have to get my booster from the same provider as the first 2 doses? No, you can go to a different provider for this 3rd shot. Also, what do I do if I got the single shot vaccine made by Johnson & Johnson? That is a very good question, and the answer is just hold tight. Dr. Richard Besser of the Robert Wood Johnson Foundation tells ABC News tonight that studies for a second J&J shot are currently underway.
Colorado school districts changing course when it comes to masks. Just in the last 30 minutes, Littleton Public Schools announced it will require masks for students ages 2 to 11. An hour before that, Douglas County schools, once adamantly against masks, announced those students will also mask up starting Monday. And this all comes on the heels of a vote by Tri-County Health to require face coverings. Denver7's Eddie Guajardo continues tonight's in-depth team coverage.
That decision comes just 1 week after Douglas County commissioners passed the resolution opposing vaccine and mask mandates, and just hours after the Tri-County Health Department adopted a new public health order. That public health order requires masks for kids ages 2 to 11 in all indoor school settings. Masks will also be required for anyone working with children within these ages. We did some digging, and some school districts that fall into these 3 counties include Cherry Creek Schools, Adams 12 5-star schools, and Aurora Public Schools. They all have a mask requirement in place.
Unfortunately, the Delta variant has changed the equation in that the Delta variant is absolutely more transmissible. So more people are getting COVID than before, and children are no exception.
The mask public health order goes into effect on August 23rd.
Addie Guajardo, Denver 7.
And students in Denver will also have to mask up starting tomorrow. Today, Denver City and County issued a new order mandating masks for everyone age 2 and older in all schools, child care centers, and at all school-based activities.
And travelers, the TSA is extending its mask mandate for 5 more months. Denver7 CB Cotton picks up our in-depth team coverage tonight from DIA.
Ann and Shannon, mask wearing will continue here at DIA, not just here, but also on trains and buses. Now, the TSA's original order was set to expire on September 13th. A TSA spokesperson confirmed to Denver7 that the order will be extended for at least 4 more months or through January 18th, 2022. The rule for travelers also applies to public transportation employees. A spokesperson for DIA tells me they'll keep up all their signage, reminding passengers and employees of the continued mask mandate. There are exemptions for children under the age of 2 and for people with certain disabilities. Most travelers we spoke with were okay with the extended protocol.
Well, we gotta get this thing under control, and obviously when you're traveling, you're around a lot of people.
Well, until we find out what this variant's going to do, and not everybody's vaccinated, I think to protect everybody, I think it's a small thing to do, very small thing to do.
We also spoke with some travelers off camera who say they're over these masks. The largest union of flight attendants says mask wearing will keep aviation workers and passengers safe. Now, I also reached out to the Department of Homeland Security to see if there are any discussions about requiring vaccinations for travelers, but I have not yet heard back. Reporting from DIA, I'm CB Cotton, Denver7.
And mask requirements have been at the center of a dramatic rise of violent incidents on airlines. A closer look at the numbers for you tonight. The FAA says so far this year, there have been nearly 4,000 reports of unruly passengers, and nearly 3/4 of those incidents have been mask related. The FAA recently raised its maximum fine against these unruly passengers to $37,000 per violation.
Now, Red Rocks is not requiring vaccines for all concerts at this time, but performers are letting their preferences known. Nathaniel Rateliff will require vaccines or a negative test from concert goers for his band's 3-night set at the historic venue next week. And if neither is possible, AEG is also offering an option for people to resell their tickets. The other major story we are following tonight, the fluid situation in Afghanistan. Tonight, the State Department reports that all U.S. Embassy personnel have been evacuated from Kabul.
The focus now turns to getting U.S. citizens and Afghans who helped U.S. forces out of that country. And today, the Taliban held its first press conference since taking Kabul. A spokesperson told reporters that Americans and Afghans who aided the U.S. will be allowed to leave.
We are assuring the safety of all those who have worked with the United States and allied forces, whether as interpreters or any other field that they have worked with them.
The Taliban also says women will maintain the rights that they have enjoyed over the past 20 years under the country's Western-backed government. Now, despite those assurances, there have been reports tonight of Taliban fighters either blocking or beating people who are trying to get to the airport there in Kabul. The State Department says it is monitoring the situation and does not take the Taliban at its word.
Denver area groups who work with refugees tell us they expect to see Afghanis entering our community in the coming days. Health clinics are preparing to provide checkups and dental screenings as soon as those people arrive. And when refugees arrive here, they need everything: food, clothing, diapers, any other basic household items you can think of. So if you're looking for ways to donate, we have put together a list of ways you can help on thedenverchannel.com. And a group of Colorado kids is stepping up to help those trying to flee the chaos in Afghanistan.
Denver7 photojournalist James Doherty shows us how they're pitching in.
Lemonade for $2 and $1.
Just like my mother used to make.
More lemon, please.
Oh!
The lemonade is Timber's grandmother's special recipe.
Mine's rum and his is Timber.
Yep, Timber. Timber's been really wanting to do a lemonade stand.
First, put the syrup.
Thank you so much.
She wanted sparkling.
Really good, guys.
Our business is going great.
We're going to donate the proceeds from the lemonade stand to International Rescue Committee.
We're giving it to the refugee people.
Oh, Afghanistan, yeah. It's a tough situation, huh?
10?
Last I checked, it was well over $250. If everyone takes small steps to
do something, then maybe it will make a difference.
Hot again today and tomorrow, but then a big change as this cold front moves in.
Plus, we'll explain how severe weather could impact the long-term cleanup on I-70.
And we're taking a 360 look at a simple question. Should you let your child go to school sick?
Any illness could be confused with COVID, or COVID could be confused with any illness.
The question has evolved during this pandemic, and tonight, multiple perspectives as kids return to class.
I am worried about the other people at the school too.